This tiny pill is taken by millions of people every single day. Doctors call it safe. Pharmacies hand it out without hesitation. But for some people, this medicine quietly changes their body in ways no one warns them about. If you or someone you love takes amlodipine for blood pressure, you need to hear this carefully. In today's video, I'm going to reveal the 10 worst side effects of amlodipine you should never ignore. These are not rare textbook reactions. These are real-life symptoms people experience every day and often dismiss as normal or unrelated. Let me be very clear from the start, this is not an anti-medicine video. Amlodipine saves lives. For many people, it works well. But ignoring warning signs from your body can quietly create bigger problems later. And please watch till the end, because the final side effect is the most commonly missed one, and over time it can silently strain your heart without obvious symptoms. Amlodipine works by relaxing blood vessels. When blood vessels relax, blood pressure comes down. On paper, that sounds perfect, but when blood vessels relax too much, or in places where the body doesn't want them to, the nervous system starts compensating. That compensation is where many side effects begin. If you've ever felt that something feels off after starting this medicine, but you were told everything is fine, this video is for you. One of the earliest side effects people notice is sudden flushing or heat waves. You may feel your face getting warm or red or slightly burning. Sometimes your chest or neck feels hot for no clear reason. This happens because amlodipine widens small blood vessels near the skin. More blood rushes to the surface, creating warmth and redness. If this happens occasionally and fades quickly, it's usually harmless, but if flushing happens frequently and is paired with dizziness, palpitations, or weakness, that's not something to brush off. That combination means your body is struggling to maintain balance. Another side effect many people underestimate is headache, but not the typical kind. This headache feels like pressure, throbbing, or pulsing, especially behind the eyes or temples. It's caused by sudden changes in blood vessel diameter inside the head. If headaches started only after amlodipine, especially after increasing the dose, that's your signal to speak up. Now here's a side effect almost everyone has heard of, but very few truly understand: swollen ankles and feet. You wake up in the morning and feel okay, but by evening your socks leave deep marks, shoes feel tighter, ankles look puffy. This is not kidney failure, this is not fat gain. This happens because blood pools in the lower legs when veins can't push blood back effectively after vessel relaxation. This is actually the most common reason people stop amlodipine. Mild swelling may be manageable, but if one leg swells more than the other, or swelling keeps increasing month after month, or swelling comes with breathlessness, never ignore it. Many people say something like this: "My blood pressure improved, but my heart feels louder." They notice a racing heart, pounding heartbeat, or skipped beats. This happens because when blood pressure drops suddenly, your body releases adrenaline to protect blood flow to vital organs. Your heart is not weak, it's working harder to compensate. Palpitations that happen at rest, come with lightheadedness, or trigger anxiety-like episodes should never be ignored. Now here's a side effect that is often mistaken for anxiety or panic disorder: dizziness and imbalance. Not spinning, not vertigo, just a strange off-balance feeling, especially while walking or standing up. Amlodipine can temporarily reduce blood flow to the brain during movement, especially in the early months or after dose changes. If dizziness happens only in the first few days, that can be normal, but if it appears weeks later or gets worse over time, your body is telling you something important. Another common but overlooked side effect is deep fatigue. This is not laziness, this is not depression, this is physiological. When blood vessels are too relaxed, muscles may receive less effective oxygen delivery. You may feel drained even after sleeping well. If fatigue worsens after increasing the dose or comes with breathlessness, it deserves attention. Some changes are subtle but visible. Gum overgrowth is a documented side effect of calcium channel blockers like amlodipine. Gums may swell, bleed easily, or start covering more of the teeth. Many people blame brushing technique or toothpaste and never connect it to medication. Good oral hygiene helps reduce severity, but ignoring it allows it to worsen. Digestive discomfort is another side effect that often flies under the radar. Bloating, nausea, feeling full quickly, or mild constipation can occur because smooth muscles in the digestive tract also relax. Occasional discomfort is common, but persistent nausea, appetite loss, or unexplained weight changes should never be ignored. Now we're entering the serious zone. Some people experience new or worsening chest discomfort after starting amlodipine. This does not mean the medicine is causing a heart attack, but it can happen if blood pressure drops too fast and reduces blood flow to the heart muscle itself. Chest pain that appears while walking, comes with sweating, or was not present before starting medication needs immediate medical attention. And now, the most important side effect, the one that is most often missed: long-term reflex heart strain. When blood vessels remain relaxed for long periods, the heart may constantly work harder to maintain circulation. Over time, this can contribute to thickening of the heart muscle, especially in younger patients or those sensitive to blood pressure changes. This does not happen to everyone, and it does not happen overnight, but ignoring warning signs increases the risk. Warning signs include persistent palpitations, reduced exercise tolerance, breathlessness with mild activity, and feeling exhausted after simple tasks. If you notice these signs, do not stop amlodipine abruptly. Stopping abruptly can cause dangerous blood pressure spikes. Instead, track your symptoms daily. Note when they appear in relation to your dose. Speak to your doctor about dose adjustment or combination therapy. Often, lower doses combined with lifestyle changes work better than increasing medication alone. Medicines are tools. They are not magic. They help when used wisely and monitored carefully. Your body speaks before it breaks. Listening early prevents damage later. If this video helped you understand your body better, not scare you, then you're exactly why HealthPulse Haven exists. If you know someone silently struggling with side effects, share this video with them, and subscribe for science-backed health content that empowers you without fear or exaggeration.